Natural eggshell membrane is an innovative supplement, and it can bring fast relief to people who are suffering pain from stiffness, impaired mobility, and osteoarthritis. Recent studies show the natural eggshell membrane begins to reduce joint pain and to improve mobility within 7 to 10 days. After 30 days, it can reduce pain by an average of 72% and improve flexibility by 44% without any side effects. The eggshell membrane is a natural source of collagen, chondroitin, and hyaluronic acid, each of which is known to support the joint health. Other studies show the long-term use of glucosamine can be more effective than analgesics and non-steroidal anti-inflammatory drugs for reducing pain, stiffness, and swelling of the joints. The eggshell membrane boosts the production of critical joint molecules. For example, it supports the body's production of type 2 collagen, and this is the main component of the cartilage that covers bone, particularly weight-bearing joints such as knees and hips, so they move more smoothly without rubbing together. Osteoarthritis is a progressive disorder of the joints caused by the gradual loss of the cartilage. The eggshell membrane also boosts the production of glycosaminoglycans. These include chondroitin sulfate. These are important components of the cartilage, and they provide resistance to compression and contribute to the tensile strength of the cartilage, tendons, and ligaments. The clinical research on the eggshell membrane began with a pilot study published in 2009. Patients with mild to moderate joint pain received 500 milligrams of the eggshell membrane every day. After 7 days, the participants had an average 26% improvement in pain and a 28% improvement in flexibility. After 30 days, they had an average 73% reduction in pain, with 45% of the participants reporting they were completely pain-free. They also had a 44% improvement in flexibility and 76% less pain through their range of motion, and no adverse effects were reported. To further support the safety and the efficacy of the eggshell membrane in osteoarthritis, a double-blind, placebo-controlled trial was conducted with 67 patients who had osteoarthritis of the knee. They received either 500 milligrams of the eggshell membrane every day or placebo. After only 10 days, those who were receiving the eggshell membrane had a 12% reduction in pain and 17% less stiffness. At the end of 60 days, those who had the eggshell membrane had an average pain reduction of 15% and 31% less stiffness. 1/3 of the patients who received the eggshell membrane experienced a reduction in pain of 40% or greater, and more than half had 50% less stiffness. No adverse effects were reported, and this study was published in the August 2009 issue of Clinical Rheumatology. Drugs for the aches and pains of osteoarthritis, including non-steroidal anti-inflammatory drugs like ibuprofen and COX-2 inhibitors like Celebrex, have been shown to make the condition worse than if the patient took nothing at all. Both classes of drugs accelerate the osteoarthritis and the joint destruction by inhibiting the cartilage repair. Often, the eggshell membrane is combined with glucosamine sulfate, a natural compound that also stimulates cartilage repair. But generally, it takes a little longer to show benefits, often from 4 to 6 weeks. By combining the eggshell membrane with the glucosamine sulfate, you can get a boost from both worlds: the immediate relief offered by the eggshell membrane and the additional long-term support provided by the glucosamine sulfate. To book a consultation or to learn about herbs, supplements, and natural treatments, check out my website.